I'm Vicky Guys, and I'm health and wellbeing coach for Dene and Stour PCN, and I cover 3 surgeries in the area. My role is to offer a non-medical holistic approach for patients, helping them look at all lifestyle factors that may affect their health, in the hope that we can improve their health and empower them to manage their health themselves. Before our team were in place, the wellbeing team, a patient would go to the GP for health reasons, and it was often first port of call. However, the factors affecting their health weren't necessarily medical. So there are many non-medical lifestyle factors that affect patients. For example, stress and anxiety due to financial pressures or relationships or career. So there are many factors that actually a GP or a nurse, a clinical team can't deal with. So they would be referred on to another service, which is time consuming, often not available. Therefore, patients wouldn't take the next action, and then they would return back to the surgery with the same or worse state of health. So since our team have come in place, which is the wellbeing team, we can offer that service at the surgery. So patients feel supported, they don't need to be referred on, so it's saving time. And we can also communicate with the clinicians to make sure that their health is on track. And we offer that service as a team. There's a social prescriber, myself, health and wellbeing coach, and a care coordinator. And between the 3 of us, we triage the patient when the referral comes in from the team, from either a doctor or a nurse, or in any member of staff actually. And then we will look at our expertise, see where we feel that they're most needed, prioritise it. So, for example, if finance is involved, it's often the biggest stress. So we will deal with that bit first through the social prescriber, then maybe pass them over to me to look at maybe diet, exercise, self-care and that sort of thing. I think the biggest benefit or one of the biggest benefits of the multidisciplinary team and the wellbeing team specifically is that the patients feel supported by the surgery, and it's a seamless service. So we can talk to the clinicians, they can talk to us, and the patient can talk to both. And the patients to have that one service at their practice where they feel very comfortable and trusted makes a huge impact, because they know that they can get everything they need from one place. My role started 12 months ago, and I was the first health and wellbeing coach in this PCN, and I started the same time as a social prescriber and the care coordinator. So our wellbeing team evolved. Now we have expanded the team, and we've got two social prescribers, 2 health and wellbeing coaches, and we are sharing with other PCNs locally and nationally now. We're sharing practice, we're sharing templates, we're sharing shared knowledge, we're offering peer support for each other, particularly in the areas of resources. So whether it's local resources or national resources, things like mental health specifics, and the further afield we go, the more information we gain back as well, and it seems to be working really well. A 59-year-old male, lives alone, history of mental health issues, including personality disorder and depression, financial concerns, bereavement, recently lost his father, poor relationship with his sister, a hoarder, and overweight. So the social prescriber helped with debt advice, housing support, organised a duty solicitor, and also helped him apply for some health benefits so that he had some finances to deal with his health ongoing, which made a huge difference, and also organised for a support worker so he could have someone specifically for him in that area, which when the patient arrived with us, was completely overwhelmed, really took the pressure off, and that was important to get those bits sorted first. I met with the patient as health and wellbeing coach. He was extremely defensive. He was in tears. He was struggling to breathe, and he was really defensive and almost a little bit aggressive. So my role was to, first of all, calm him down, let him talk about everything that was going on in his life. So all of the financial areas, absolutely everything, and then work out what he needed and what was in his control. That included teaching him some techniques on breathing so that he could help his breathing and his anxiety, to ask him if he was able to revisit his diet because he was really overweight, which wasn't helping his breathing. So he started cooking again. He'd become so overwhelmed with everything that he had stopped listening to music. He'd started hoarding more in his house. So everything was chaos. So he slowly decluttered his house. He started putting music on to help him relax. He was actually quite a spiritual person, and he'd completely disconnected with it. So he came back to that. He was practicing with his crystals. He was breathing. He was meditating. He did up an old bike that was in his garage so that he could start riding his bike again. And within 2 weeks, he revisited, and he was a different man. He looked different. His demeanour was different, and he felt happy, in control. And we worked with him for a couple of months until he found that he was in charge of his life again and felt in control. His health improved, and he had his zest for life back, and it was fantastic. In terms of what's next, the team's expanding, the skills are expanding, and I think it's important that clinicians and the surgeries are really aware of what the team can offer. These multidisciplinary teams are very new. We're not used to having them on tap, and I think the more we can communicate and share the service available, the better. The better for the clinicians, and certainly the better for the patients, so that their general health is improved and their future is brighter.